Paid parental leave, a presentation by APRNs and DNP students, Elaine Candeloro, Tony Fram, Deborah Wainwright, Anna Verzone, and Karin Reed. The views or opinions expressed in this presentation are solely those of the authors and do not necessarily reflect the views or opinions of Frontier Nursing University. The United States is the only developed country that doesn't guarantee paid leave for workers who are new parents. Compared to other developed countries such as Canada and the United Kingdom, the United States lags far behind in financial support for parental leave. Canada, France, and the Netherlands all offer over 15 weeks, and the UK offers 40 weeks. However, in the United States, the Federal Family and Medical Leave Act gives workers the right to 12 weeks of unpaid leave, and only if the company meets certain conditions, such as having at least 50 employees. The Family and Medical Leave Act, FMLA, was enacted in 1993 to grant up to 12 weeks of unpaid, job-protected leave to eligible employees who need to care for their children or other family members. Unfortunately, there hasn't been much major federal legislation designated to support working families since. The consequences are shocking. Only 12% of workers have access to paid family leave through their employers. Less than half of all workers are covered by unpaid leave. 25% of women either quit or are let go when they have a baby. Of those who get partial pay or nothing at all, a third borrow money and or dip into their savings. 15% go on to public assistance. While many may think of paid parental leave only as additional costs, there are several ways that it ultimately leads to increased economic and social benefits. 3 states, California, New Jersey, and Rhode Island, offer guaranteed paid leave. The programs are funded by employees' payroll deductions. Because California's paid family leave program is 10 years old and New Jersey's program was instituted in 2009, there is a body of research about the financial impact of paid family leave. Paid leave programs, financed by payroll deductions, cost individual employees less than $1 a week. Having state-mandated paid family leave hasn't hurt most employers' bottom lines. In a survey of California business owners, 89 to 99% said the program has had a positive or no negative effect on profitability and performance, productivity, turnover, and employee morale. Millennials are part of a dual career couple. When new parents aren't offered financial support during their leave, they will leave their jobs. This leads to a lack of skilled workers and subsequent loss in productivity. Fact: 38% of U.S. millennials would move over to another country with paid parental leave benefits. Training new employees has been estimated to be 21% of the employee's annual salary, and even higher for more skilled labor. Increased job satisfaction makes workplaces more attractive for potential employees and increases retention. 86% of millennials are less likely to quit if paid parental leave is offered. 6 in 10 working moms say that balancing a job and family is difficult. All working parents, mothers, and fathers agree that this balance is very difficult. Studies reveal that in European countries where paid parental leave is offered, there is an increased labor force participation for women and a decrease in unemployment. This leads to a boost in overall productivity. Paid parental leave can have outstanding effects on national economy. It can lower unemployment rates and more capital available to put back into the economy. It reduces reliance on public assistance. Women who return to work after taking paid leave are about 40% less likely to receive public assistance in the year after giving birth than the women who keep working and have no leave at all. There is a wide wage gap between men and women in the same job. The time that women spend out of the workforce unpaid to have children. With paid leave, women are able to build more tenure and experience in their jobs, and this can raise their earnings and help close the pay gap. Workers are more likely to maintain their pre-leave wage level if they stay with the same employer than if they must find a new job. That can raise the long-term earnings, contributing to the health of the economy. Extending paid parental leave can have multiple benefits on the mother and the infant. Mothers who return to work with 1 year had less than 12 weeks of maternity leave or less than 8 weeks of paid leave had higher depression rates. 6 months is the optimal maternity leave time to reduce postpartum depression. African American women have the highest rates of maternal morbidity but return from maternity leave the soonest. The cost of treating untreated postpartum depression per mother is $7,200 a year, and there is an estimated total loss of $5.7 billion productivity. For the infant, The mothers who receive paid maternity leave have slightly increased birth weeks and lower incidence of premature births. Every month of paid maternity leave can reduce infant mortality rates by up to 13% in low to middle income families. Longer periods of bonding can prevent behavioral and developmental delays, and children who attend daycare facilities are more prone to illness, which also decreases the productivity of the mothers if they have to leave work to care for their child. Preterm birth results in a loss of up to $26 billion a year in the United States, and the average cost of childcare per year is $10,468. The American Association of Pediatrics recommends breastfeeding for the first 12 months of life. The World Health Organization recommends breastfeeding until 2 years of age or beyond. The goal for breastfeeding is that 60.6% of babies should be breastfed at 6 months. In the United States, 51.4% were breastfed at 6 months. Full-time working mothers who received 12 weeks of paid maternity leave were 3 times more likely to breastfeed their babies and twice as likely to still be breastfeeding at 6 months than those who did not receive paid maternity leave. Mothers who are expected to return to work within 6 weeks were 40% less likely to plan to breastfeed than those who returned to work within 12 weeks. If 90% of infants in the United States were breastfed for 6 months, it would save $13 billion a year and save 911 lives in both direct and indirect costs for medical care and loss of productivity from care. And over $5 million would be saved alone just related to childhood illnesses.
Currently, there are 5 states that have paid maternity leave, and on an average, a mother will receive around $3,000 over 12 weeks. There are many factors that affect a woman and her birth. Physical stress and mental stress have devastating results on a mother and her baby. For example, low birth weights and early term births are associated with higher costs, but with paid maternity leave, low births are decreased by 3.2%, and there's a decrease in early term births by 6.6%. Studies show that birth weight has a positive correlation with lifetime earnings, and with each 1% increase in birth weight, it has a direct effect on increasing one's income by 0.1%, and these benefits outweigh the cost of paid maternity leave. Studies have shown that the economy benefits from maternity leave by an increase in workers, and there is less government assistance. Paid maternity leave also boosts the economy by increasing job commitment and increasing wages because it decreases costs for replacements of employees. While the elite employees have coverage, the low-income workers are not getting paid maternity leave, and it is causing an even bigger gap between the elite and low-income workers in the United States. Paid maternity leave helps decrease costs in the long run by not driving families below the poverty line. Paid maternity leave has shown a decrease in infant and child mortality by 20%. You may be asking yourself, what does this exactly mean? It means that many lives are saved with paid maternity leave. If this has not convinced you that paid maternity leave matters, then I'd invite you to listen to the following story about Julie. Julie is a 31-year-old woman that worked as a secretary before she had her baby. However, she cannot financially afford to have 12 weeks off with no pay. Her husband works, but both incomes are needed to make ends meet. Julie had to return to work 4 weeks after she had her baby. She experienced stress and maternal anxiety, and she eventually had to stop breastfeeding. She went into depression and eventually lost her job and had to go on public assistance for a short time. Julie made it through a depression and got another job, but with less pay. This happens more often than people think. Julie's story could have been very different if she had had paid maternity leave. She could have continued to breastfeed, had better pay, and an increase in her earnings in the long run, decreased health costs, and would not have had to go on public assistance. In the long run, her employer would have also benefited more because the employer would have not lost money retraining a new employee. The answer is clear, and that is that paid maternity leave matters not only to the person receiving it, but it also affects the employer, families, and the economy in positive ways. The time is long overdue for the United States to have paid maternity leave. It is time to take action and vote for paid maternity leave for all the states in the United States. Access for everyone for paid maternity leave will positively impact the economy and help with better health outcomes for families. Paid maternity leave is the answer and will impact your children and future generations to come. The choice is yours to make.